it's Dr. Justine with Derek. We're going to learn about cupping.
All right. So for this cupping treatment, main things that we need to kind of get under wraps. When it comes to cupping, what we're trying to achieve here is we're trying to basically draw any stagnant fluids that are from the body towards the surface so they can be drained out by the lymph system. Cupping is a great way of being able to do that to encourage more muscle movement, as well as it's a great way of being able to decompress muscles that might be pushing on other structures such as nerves, such as other things that might be causing other type of pain as well. Okay, so main thing what we want to first do is get some oil on the back. Now the cupping procedure, there are different ways of cupping. There is static cupping, which is more or less a more traditional way of cupping that people are used to. This is a decompression cupping treatment, so this will be a gliding treatment more than anything else. Both treatments will aim to do the same thing. What we're looking from a response from Justine is hoping that the cups will not cause any type of major discomfort. It should feel like a small pull, but it should feel more comfortable more than anything else. So I'll be checking in for Justine's response to the treatment. That's okay, Justine?
Yep.
All right. So the classic red circles or red bruising that people are used to from cups, you are still going to be getting because we are doing the same type of treatment, but it's not really bruising. What we're doing is we're just drawing that stagnant blood towards the surface. Bruising is more black and yellow in color, whereas this is going to be more of a red mark that you're going to be seeing.
Okay.
All right, so let's get the cups on. Okay. Right along the spine. And what we're doing is the cups just act as like an extension of my hand. How's that feel, Justine?
Feels good.
Perfect. So if you want to zoom in on the back a little bit, you see that the red is already starting to form right along the erectors.
Feels really good.
So the cups just act as like an extension of my hand. It kind of feels like a deep tissue treatment in itself. Except that I'm not putting in any pressure. The cups are doing everything just to decompress and pull the muscles out, pulls the fluid towards the surface so that it can be drawn out.
You need my arms down or my
You can actually place it towards the side. That may be a little bit better for me to access the traps. Perfect. There we go.
So there's no fire, there's no
fire. The silicone cups, they basically act to pull the muscle. The glass cups, since they're glass and they don't have like any way of being able to squeeze into them, they use the fire just to remove that oxygen and draw the blood that way. But with silicone cups, you're basically just squeezing the cups and it does the exact same action.
Cool.
All right, so we'll focus in on this side. Sometimes if the back isn't lubricated as much, the cups will kind of like sort of loosen its grip. Yep. So let's get a little bit more oil on there. As you can see, we've only been working on Justine's back for a couple of minutes, but you can already see there's already that redness there. And what this also helps to do too is it helps to loosen up the muscles a lot quicker. So if I wanted to do any deep tissue techniques afterwards, it's a lot easier for me to get deeper as opposed to me having to warm up the back as I normally would.
And what does someone expect afterwards?
So afterwards, there might be a little bit of fatigue after the treatment because it is a little bit more of a different treatment altogether. You can expect to see a little bit of redness, just as you would with the regular cupping treatment that will go away after. Typically, we recommend that you don't do anything strenuous for the rest of the day while doing a full body treatment when it comes to cupping. Doing the upper back, I find that like energy-wise, you're probably going to be okay, but that's always going to be a factor. Otherwise, you shouldn't really feel much of anything else. There might be the occasional soreness, as it is with a lot of manual techniques anyways. But again, a hot shower and Epsom salt bath will definitely help to kind of mitigate those symptoms as well.
And water, I guess?
Yes, keeping yourself hydrated for sure after the treatment too will definitely be good for you.
It feels good.
Definitely. Usually, people will tend to feel a lot more tightness around the areas where tension tends to accrue most. So around the traps, around the gastrocs or the calf muscles. I like using cupping, especially for the traps, because there's a lot of compression-based symptoms that you can typically find around here. If you're trying to work on areas such as like the chest wall as well for thoracic outlet syndrome or for piriformis syndrome around the glutes, cupping therapy is very, very good at being able to release those structures and pull the muscles off from nerve endings that would cause any type of referral patterns. You see, just like transitioning between the cups and using my elbows just to decompress. And again, because I've worked with the cups, it's a lot easier for me to get deeper into the supraspinatus and into the deeper structures around the shoulder. Doing okay, Justine?
Yeah.
Perfect. We'll just push up the back a little bit more.
It's not painful at all.
That's a good thing. All right.
I love how quick it is with the rubber ones versus the glass.
Yeah.
Because the glass, and you have to get the fire going and everything, it's slower.
Yeah, with the rubber ones, the silicone ones are a lot quicker. All you really do is just make sure that there's enough lubricant on the contact surface, and then you're good to go from there.
That feels good.
It definitely feels good around the QL area as well. So it's just something that I definitely like doing to get deeper into the QL as well. A lot of people will deal with a lot of QL stuff, especially when they're dealing with any hip issues. Post-treatment wise, definitely try to keep yourself hydrated, and any type of post-treatment that you would do for massage treatment or chiropractic adjustment. So again, doing an Epsom salt bath or any type of bath afterwards, just to keep the muscles warm after the fact. In terms of contraindications, I wouldn't recommend doing cupping therapy if there's any lymphedema issues. So if there's any issues with the lymph as well, because it will have an impact on that. People who are post-cancer, so if they're dealing, they've had like any cancers in the past, within the last 5 years, and it wouldn't be recommended because the drawing of fluids could reactivate things or aggravate things as well. Otherwise, cupping is pretty safe to do for most situations. Good to go.
All right, great job, guys. Give it a shot. Make an appointment with Derek and learn more about cupping. It's awesome.